A warm welcome, everybody. I'm Erin Michalak. I'm the leader and director of CREST-BD, and it's my extreme pleasure to join you today for the last of the series of talkBD for 2020. The year that many of us are going to be happy to see the back of, I think. We will be joining you for these events through 2021 too, so this won't be the last event, but I'm particularly excited about today's, and part of that for me, to be honest, is personal. I don't actually live with bipolar disorder myself, but I am constantly extremely worried about my cognitive functioning. It's actually, I had a car accident when I was a teenager and quite a severe head injury at the time. And, I like to kind of understand that I think and memorize things so badly because of that head injury, but regardless what the reason is for it, it's a constant source of embarrassment for me. I have a hard time in particular remembering people's names. I've been known on many occasions to do things like stand there at my office door with my key fob trying to open it. And it's something that is really kind of weighs on me. So just personally, I'm really excited for the event today. As you know, if you've been joining us through the year for these events, we pick them on topics of choice by our community, and they're really good for people with bipolar disorder, but also for the general population as well. So we hope there'll be tips and tools shared today by our three speakers. So welcome to everybody. There's quite a few of you joining us by Zoom, by Facebook Live, or streaming this event. Wish us luck. This is the first time we've tried to do it with three speakers. So let's dive right in, start with some introductions, and we'll start with Dr. Trisha Chakrabarty.
Thanks, Erin, and hi, everyone. I'm thrilled to be here. I'm so glad Erin and Kaden and the team invited me. So I'm a psychiatrist. I do outpatient work at the Mood Disorder Center at UBC. I'm also an assistant professor, so I do research as well, and my area of research focus is cognition in mood disorders. So just, I guess, going on with the comment that Erin had made, I've also always had a bit of a personal interest in cognition because I find that my spatial navigation skills are like really, really lacking. Like I need GPS to get from point A to point B, no matter how many times I've gone that route. And that's always been a real source of embarrassment to me. And I've always wondered, like, I wonder why I'm just so bad at doing that. So that's kind of my my embarrassing sort of deficit I find myself with. So I'm just so thrilled to be here and to be joining Victoria and Ivan.
Welcome, Trisha. And one of the things we always do with these events is ask people to talk about something that has nothing to do with their work life, something that you've been doing for yourself over the last year to maintain your own balance and wellness.
So I have found, especially since March, I have tried to resume a sort of daily yoga practice, which has been helpful. And I found there's a YouTube channel that has 10-minute yoga videos, which is also helpful because I always think, no matter how tired or unmotivated I feel, it's like, well, I can manage 10 minutes. And sometimes it turns into more and sometimes it doesn't. But it's been really nice to have that kind of bite-sized yoga to help keep me sane during this time.
Nice, thank you. Ivan Torres.
Hello and welcome everyone. It is very much of a pleasure to be here with you today and with some colleagues and friends so we can share some experiences and hopefully provide some information that can be useful. So just by way of introduction, I'm a clinical professor at University of British Columbia. And my roles are, and I'm also a clinical neuropsychologist by training. So the clinical work that I do revolves around doing basically cognitive evaluations in various different clinical populations, although the unit that I work in right now is primarily involved in treating people with psychosis and similar kinds of challenges. but my area in general is in mood disorders and psychosis. And I've been practicing for many years now, throughout my career, even though I also have done a lot of research in the area. I've always maintained, you know, clinical work as part of what I do. It's certainly a passion of mine that goes back many years now. Since we're self-revealing about personal cognitive limitations here, I must say that the things that I really struggle with are in some of the verbal memory kinds of tasks that we give some of our clients who we see for evaluations. I'm very humbled by the fact that you know, people are you know, in the course of evaluations that that we're putting, you know, we're making people exercise their brains and work really hard, and I don't see how on some of the verbal memory tests, which are very challenging, where you basically present verbal information and you're not allowed to write this stuff down and you have to keep it in mind. That's something that I've always found very challenging. But nonetheless, it's thrilled to be here today, and I look forward to our conversation.
You're a drummer, right? Surely does that take a different type of memory from verbal memory, I guess?
Yes, that's right. I'm much better at the nonverbal things. I can remember designs and, you know, sort of spatial kinds of things. But when it comes to the stuff that you hear, like in a, you know, in a classroom, it's much more of a struggle.
Thanks, Ivan. And Victoria.
Hi, welcome everybody. It's great to see everybody here, and Trisha and Ivan, it's wonderful to be here with you. For those of you who don't know me, I'm a mental health speaker and I live with bipolar disorder, anxiety, and psychosis. I've been living with it fairly well for the last 20 years, still experience symptoms though. And I've been a core member of the CREST team since its inception, since I guess 2007, right? And really enjoy the multiple roles that I've played, and really encourage anyone that's wanting to get involved in research who happens to have the disorder to really reach out to Erin. It's a really good experience. In terms of self-disclosure around my own, you'll probably hear them as we go through the program today, because I'll be talking about sort of what happens for me in mania and depression, hypomania, and then also when my mood's quite stable. And I really need to make a point of using wellness tools to sort of support that cognitive functioning, which I think can help everybody or anybody, whether they have mental illness or not. So I'll let the surprise happen later on. And then what I do for wellness, well, recently I have rediscovered sewing. And it's not really rediscovered because I actually was really bad at it when I was in high school anyway, but I haven't done it since like grade 8 or 9. And a friend gifted me a 1958 sewing machine, which I love because it's super basic. And it's so nice. It's like meditation. It's like going away and reading a novel, and I get to, like, I walked into the sewing store. I had to get ribbons. I'm making bookmarks because they're really easy to make. And there's like ribbons everywhere and all these different colors. And it's like, oh my God, it's like an ice cream shop. Anyway, so obviously you can see I'm quite happy about that. So that's doing a lot for my mental health. So I'll let you go.
What's the old English word for that? Is it haberdashery? When you go into a shop that has all the materials laid out?
Oh, I love that.
I think somebody will tell. Somebody will tell me if I remembered that wrong, but I think that's the right word for it. It's beautiful.
Oh my goodness. Okay, that's good because I love words. So that's perfect. Thanks.
So for those of you on the line who haven't joined one of these events before, we're not doing PowerPoint for the next half an hour. We're going to go through a series of kind of key points from the speakers. You can give your questions anonymously through Zoom. You can drop them into Facebook. You can also put them anonymously through our website as well. So with that, let's dive right in. I think with Trisha, can we start with you?
Sure. I actually think we were going to start with Ivan.
Were we? My bad. I
forgot. No,
I'm sorry, Ivy. See what I mean? Okay, Ivan, let's kick off with you.
Sure. Okay. So again, as a broad overview, the topic of today's conversation is really for us to talk about basically what we would refer to as cognitive abilities. And so when we talk about that, what we're referring to is really a host of different skills that we possess that we really require to kind of navigate through our daily lives. And so to dig a little bit more specifically into that, what we're really talking about are things like attention span and ability to focus and concentrate, things like our memory skills, our ability to learn new information and to process information and to hopefully hold on to this material so we can use it to, again, function in our daily lives. I could give a lot of examples, going to the store and remembering where you parked your car might be an important thing for us to function adequately. It also encompasses kind of some of the more complex abilities too, that would include things like problem solving, our ability to plan, to come up with strategies, to organize ourselves. If you think about what modern life is like for many of us, it's really we get bombarded by information from multiple sources. The information that we get comes through our emails, to our phones, through our through cable, through a variety of different social media sources. And I find that part of what survival is managing and keeping track of all this information. And this is definitely the an era where fortunately we have our devices to help us out, but we still have to be able to manage through all these information sources. And so so one of the terms that I wanted to bring up too, that sort of speaks to some of these planning and multitasking skills, is the concept of executive functions. And if you think about executive skills, what executive skills are is a myriad of different abilities that allow us to do complex goal-directed kinds of activities. And I think one of the best examples that I often give is that if you're going to sit down and cook an elaborate meal, you really are taxing your executive abilities, because you have to do a lot of planning. You have to figure out what it is that you have to go to the store and buy your stuff, and then once you get home, you have to multitask. You have to put certain things in the oven and on the stove, and set timers, and you have to stop certain things and stop other things. It seems kind of simplistic, but really there's a lot of cognitive activities that are going on. And so I think in many ways the topic is very timely right now, because of what we're all experiencing with the exceptional changes that have been brought on by COVID. And I think that I think probably most of us would agree that life has changed in many ways for us, and the way that it has changed is that it has kept us apart from the ones that we want to be with. It has forced us to become more isolated. It has forced us to interact less with others in person and interact more through means such as Zoom talks and conversations and Skype and all the various other sort of ways of communicating these days. And with that comes a lot of psychological distress and problems with organizing ourselves. And I think that if you just consider all the changes that we've had to adapt to, that alone has the potential to disrupt all of those cognitive skills that we were talking about, our attention span, our focus, concentration, and so on. And so if you think about, and I'm not going to dig too much, but if you think about the way that the brain is organized, we have a system that deals with our ability to manage stress. Okay, we have kind of a part of the nervous system where whenever we experience stress, it leads to a variety of different bodily responses and brain changes. And one of the difficulties is that this stress-related response is actually very incompatible with our ability to process information, okay? So what that means is that, you know, the stress that's introduced by isolation and by COVID and all of these, you know, the new normal, it interferes with our ability to, you know, stay organized and maintain our normal, you know, ways of living. And so, so again, I think it's important to just recognize that, you know, in these exceptional times, we're already at a disadvantage when it comes to, you know, functioning optimally in terms of our cognition. So, so again, what that means is that as part of our management of trying to, you know, keep our brains healthy and to keep our cognition functioning optimally, what we also have to keep in mind is that we need to keep our sort of emotional state and our stress system also, you know, managed and taken care of as well. So, you know, so again, it's sort of double duty, you know, keeping track of things, but also managing stress and managing all these exceptional changes that we've had to endure. So, so again, with that introduction, I think we were going to now turn over to Trisha, and she's going to talk a little bit about more specifically some of the cognitive experiences that much of the research has shown that people with bipolar disorder tend to experience.
Yeah, yeah.
Before we do that, Trisha, can we just see if Victoria has anything that she wanted to bounce off what Ivan just presented and that idea of double duty? Does it feel like that for you, Victoria? Does it feel like we're doubling down in terms of the impact of stress and anxiety contextualized in COVID laid onto cognitive issues and bipolar disorder for you?
Yeah, I mean, I guess I never framed it that way. But I've definitely doubled down on all my tools and my skills because I've found that my mood disorder has been more affected and the symptoms are exacerbated. So in the last 6 months, I've experienced far more depression, anxiety than I have probably in the last 5 years. And so, and with that, just my ability to, I was thinking about when you were describing all the things that really are considered cognitive, is prioritizing, right? Decision making. And if you have a job, if you're lucky enough right now to have a job, it's so essential to have those skills so that you can maintain that. And then the irony that you're saying how our body with a stress response, which helps us physically, in quotes, get away from the threat or fight the threat, in modern times, it's not helpful because most of the times in order to deal with our stress, we need our cognitive ability. And so when you said this, I realized why I've been focusing so much on managing my stress response, which always seems to be triggered 536 times a day. And so one of the wellness tools is doing mini mindfulness. I like your idea of bites of yoga, bites of mindfulness, really belly breathing, all these things that are really simple, but also really soothing. And that can be done in a Zoom call and nobody would know. So that, they're portable. So I hope that sort of reflects some of what you were saying, Ivan.
Yeah, so I think that, extending off what Victoria and Ivan have talked about, certainly there is, especially this year, this universal experience of having to deal with all these external stressors and internal anxiety and tension that to some degree is impacting everyone in terms of their cognitive abilities. And then aside from that, the research has also shown that with a bipolar disorder diagnosis, that's often associated with changes in cognitive ability. So things like memory, concentration, executive functioning, as Ivan mentioned, that when we look at group averages and we take a group of individuals with bipolar disorder and we compare their average performance against a group without bipolar disorder or without any diagnosable psychiatric illness, we see we see differences in those averages. That being said, we're sort of, having established that, we're sort of now at the point of just trying to understand to what degree that's prevalent across, the entire range of individuals with bipolar disorder, and what are the specific contributors to those cognitive deficits. So with the first point, in terms of the prevalence of those deficits, you might have seen, just with Ivan, Erin, and myself, who've disclosed some of the cognitive deficits that we find ourselves struggling with. Regardless of whether you're someone living with bipolar disorder or not, within a population, there's huge variability in terms of cognitive abilities, and where people have deficits and where people have strengths. And just now we're starting to see research looking at individuals with bipolar disorder and looking at what the variability is. So not just, looking at group averages, but are there different individual variations in cognitive abilities? And the research, even though it's kind of in its infancy, is suggesting that yes, there is. And that what tends to be the pattern amongst these studies is, there is a group of individuals with a bipolar diagnosis who seem to show impairments across multiple different domains. But then there's a group that only shows impairments in certain cognitive domains. So they might show impairments in things like attention or how quickly they're able to process information, but other things like memory, executive functioning are well within a normal range. And then there is a group that functions across the board well within a normal range, if not even better than average in certain domains. So there is huge variability in terms of cognitive ability in individuals with bipolar disorder. So all that to say, receiving a diagnosis of bipolar disorder does not automatically mean that you will struggle with cognitive deficits. It does not mean that you will struggle with cognitive deficits across all of these different domains, and that it's something that's kind of highly variable across the population. And in terms of potential contributors to the severity of cognitive deficits that one might experience, and I think at this point I'll let Victoria kind of talk more about her personal experience. One of those things is the mood state that you're in and how severe your mood symptoms are, which is certainly something that can contribute to the degree and type of cognitive deficits you're struggling with at any point in time. So maybe I'll let Victoria talk a bit more about her own personal experience with that.
Yeah, because I think Ivan and you were also going to speak about when we don't have symptoms and we're sort of in that sort of phase. And I definitely, this really was a great way to reflect on when, for me, I have sort of an anxious state, which is most of the time actually, depression, hypomania, mania, psychosis, and then sort of when I'm really stable. And most times I'm in this well state, but subtle things. And I notice a lot of differences. So with depression, it's comprehension. So a lot of times it's really hard to remain engaged and focus and concentrate, but particularly if I'm reading or trying to absorb some kind of information, it takes a lot more effort to do so. And part of that is also my lack of engagement and motivation because I'm in a depressed state. And also just that fatigue that happens. So I think my whole body doesn't have the same amount of energy available to use these sort of skills. And then in hypomania, the interesting thing is that when I feel like that's when I can excel in certain areas. Before it sort of goes off the edge to mania or psychosis. So my focus is better, my efficiency is better, my decision-making skills are quicker, my creativity is contained, but still of good quality. And that also transfers over into my stable mood often. So I feel very fortunate that during my stable times where my mood state is sort of in quotes normal, I retain some good cognitive skills. I think it's contributed by the fact that I do a lot of sort of other tools like medication, exercise, nutrition, sleeping, counseling, things like this, stress management. When I go into mania and psychosis, it's a whole other ball. It's psychosis. It's completely different because I'm not. I call it a non-shared reality. So I may be functioning well in my reality, but it's certainly not your reality. So the choices I'm making put me in danger. Sometimes they're against the law, not really safe for me, things like that. And so and also strangely, I'm often so, I don't know, I don't want to say in the moment because like present state in terms of a positive way, but I am in such a present state that I don't I don't have long-term thinking. I can't see the big picture. I'm only in the moment. So it's sort of like a child almost. And mania sort of has some of those where my thinking becomes really scattered. I haven't been in mania for a long time. I've actually been more in psychosis more frequently. And then anxiety throughout it all sort of interferes with it, which is sort of the bugaboo, right? It's like the nasty older sister that's just always, bugging me, bullying me and stuff. And it creates an edginess that distracts me a lot of the time. And part of that is, cognitively negative self-talk about self-doubt, but it's the physical manifestations of it as well, where the energy level is uncomfortable. And so my inner landscape is always sort of pulling me out of what I need to be doing. So as the worse the anxiety gets, the more I have to focus on grounding. And because of that, then I don't get as much done. I can maybe get a couple of hours done in the day, and I'm working at a much slower pace. So that's when I need to bring self-compassion in a lot. So that, I would say that's sort of in a nutshell, pardon the pun anyway, how it affects me personally. And I'm not sure if we're going to Ivan or Trisha or whatever, so.
Sure, I can follow up. Thank you for that description, Victoria. I think that's you're really personalizing what I think we are sort of understanding or beginning to understand in the research arena, and that's that that as symptoms become more prominent, that there's more potential for the typical cognitive or thinking skills to be interrupted in a significant way for some.
And sorry, Ivan, I just wanted to also mention is that what I've also recognized is that when I was first diagnosed and my cognition was really impaired by depression or any of the symptoms, and when I would come out of those phases, because I did see a question around this, it was through experience of understanding how to manage my illness and what really worked for me in particular that helped bring back some of my cognitive abilities. And so if I really found that my concentration and comprehension were really poor, it was recognizing that and then finding tools that specifically worked for me and worked over that. So I think I want to give hope to people who are finding and struggling with it, even when they're not symptomatic or they are, that it's like rebuilding a muscle. And that's really what I felt like I had to do.
Okay, but again, it sounds like most of the experience that you had with the cognition being affected was kind of at the same time as you were experiencing the symptoms. The symptoms elevated, and that's when it prompted lapses in memory and focus and concentration and so on. And then you sort of brought in the strategies for managing, and then things tended to get better.
Yeah, I would say so.
Yeah, okay. And because I think that, and again, sort of taking off on some of the points that Trisha made about the variability across different individuals, that, again, we're really beginning to understand that when symptoms are prominent, cognition tends to be more affected. But when the symptoms tend to recede and get better, that there can also be some variation across people with regard to how much they continue to be affected. So for some, and it sounds like it might have been the case for you, when the symptoms kind of went away and you engaged your strategies to improve cognition and so on, and to self-manage, that your cognition got back to a place where you kind of were back to baseline, kind of to a normal state, and that's fantastic to hear. And for other folks, it is possible that there could be some persisting things that also have the potential to interfere with daily life. So meaning that, one way to sort of think about this is that some of the difficulties could be sort of state related, which tend to be kind of transient and dependent on the symptom fluctuations. And some of them could be what we would, consider to be more trait related, where, regardless of whether the symptoms are there or not, there still might be some residual difficulties that have the potential to interfere with daily life. So, but again, that's going to depend on, the particular individual. And we're just starting to understand that, that the name of the game is really more about the individual experience, that we can't generalize to everyone that has a diagnosis with bipolar disorder. And so that some may struggle more than others when it comes to these types of issues. The other thing that I think is relevant to this discussion, and I'd also, Victoria, be really curious to hear what your experience has been kind of throughout the course of the illness. And that's the question of what happens to these, cognitive difficulties that a person experiences. In other words, as as the illness kind of continues in an individual, we often get questions like, is this a progressive thing where the cognition actually tends to get worse and worse? Or is it something that is kind of, detectable early on in the illness, but then it stays relatively stable? And I think that there's, that's something that we don't really fully have an answer to that, when you turn to some of the research that's been done. I think, one of the things that we do understand is that early on in the illness, like close to the initial diagnosis, that if we do, evaluations on folks, like at the time of illness onset, that we can already detect some, cognitive difficulties in many people. But the question about what happens to that as, time continues is a bit controversial. There's been some, some data that suggests that, the more mood episodes that you experience, the more likely that you might have, progression in some of these cognitive symptoms. Although when we look at some of the longitudinal studies, in other words, the studies that have followed people, the same person across time, a lot of those data generally tend, do not support the idea that cognitive problems get worse and worse and worse. So, and we also, from some of the research that we've done at UBC, we actually have found that, for example, early on in the illness, if people, maintain their treatment regimens and are sort of adhere with the initial medications and psychosocial kinds of interventions, that there might even be a potential to show some resolution of some of these problems too. And so, so again, I don't think that it's an assumption that things are necessarily going to get worse and worse. I think that most of that data actually suggests that these cognitive difficulties actually remain pretty steady. And in some cases, you know, if it's well managed, things can actually get a bit better as well.
Such a key point of hope. I hate being chair, but part of my job as chair is to acknowledge the fact that we have so many questions coming through so thick and fast. So I'm wondering with the panel if it's okay if we get into those so that we can start to work our way through them. Would that be okay with the three of you? Okay. So thank you to everybody so far who's put questions in. Incredible international audience for this event. Somebody joining us from Algeria who states, I got my bachelor's and my master's degree in finance. I had a great job. In April last year, I was diagnosed with bipolar disorder and have struggled with memory, concentration problems, return to work. This person would like at this point to return to university and do a PhD, but they're asking really essentially, is that a feasible option? Is there the ability for them to regain enough memory and concentration to think about grad school at this point?
So I guess, first of all, thank you so much for the question. And I'm so sorry to hear about, you know, that experience. And I think the early part of the illness, or, you know, that period, the months right after you have developed symptoms and gotten the diagnosis is really challenging, because there's a lot of trial and error in terms of, you know, finding the right treatment and what's gonna work for you. And then to have COVID piled on top of that, like that's a very that's a challenging couple of years for sure. So I would say that, first of all, in general, whether it's feasible for someone after a diagnosis of bipolar disorder to resume their work or to go back into a graduate program, absolutely. There are obviously many people with individuals with a diagnosis of bipolar disorder who are able to do those things. In terms of what factors that might be playing a role in, I guess, perpetuating any memory or concentration or cognitive issues that you might be experiencing. One thing to consider is kind of like Victoria and Ivan were discussing is, if there are symptoms, mood symptoms still present, that could certainly be impacting things. So even if we often see that, you know, even if the person doesn't meet like the diagnostic threshold for a current depression, there might still be depressive symptoms there. Similarly, even if the person doesn't meet the diagnostic threshold for mania or hypomania, some of those symptoms might still be there. And those things can certainly impact cognition. And that's something to kind of work with a care provider to make sure that all of those, what we call subthreshold or subsyndromal symptoms, are being dealt with. Other things, like Victoria kind of so beautifully encapsulated, is anxiety. We know that bipolar disorder and anxiety go together often, and anxiety can certainly impact your cognition. So if there are issues with anxiety, whether it's generalized anxiety or having panic attacks or those sorts of things, those are also, that's also something else that could be addressed and might help. And then I guess maybe I'll take this opportunity to go a little bit into management strategies. So, you know, after making sure that all of the mood symptoms are adequately dealt with, anxiety is adequately dealt with, the things that we would generally recommend to people to try to maintain good cognitive functioning is, first of all, not specific to bipolar disorder. So the things that we'd recommend are things that everyone should really be doing for optimal health and functioning in day-to-day life. So, and again, as Victoria mentioned, just the things for general wellness, like we know that exercise can have a profound impact on your mood, but it can also impact the brain's ability to generate new connections between neurons and to maintain the health of your brain cells. Good diet can also play a huge role, and sleep management, because I know for myself, if I haven't slept well, then it's kind of done for the day. Like, I'm not going to be able to concentrate and focus with any sort of efficacy. So those are general things that we would sort of recommend. And then the other thing that may be more specific to bipolar disorder is the role of medications. So we know that medications are important for maintaining mood stability, which in turn is important for maintaining good cognitive functioning. But at the same time, certainly many of the medications that we can use for certain individuals may impact ability to concentrate and focus, either because they're causing the person to feel fatigued, or a direct impact on cognition. So it's important to recognize that, and important to recognize that not every medication will affect every individual the same way. So, person A might find difficulties with concentration with lithium, but not with another medication, and so forth. So that's also something to kind of discuss with your care provider in terms of the potential impact of medications. And I don't know if Victoria or Ivan had anything to add to
that. That was really, really well said, Trisha. Thanks for that. I would also add that that, I guess based on the question and the description, it sounds like the sense that there's cognitive difficulties are also coming from, from your individual experience and perception as well. And I just want to put out there the idea that really for all of us, often, our subjective reports of our own cognitive functioning surprisingly is not often consistent with with more objective markers of cognitive functioning. And so what I mean by that is that there are ways to get evaluations that could help measure and understand the extent of cognitive difficulty. And in some instances, people's cognition can actually be relatively preserved based on testing and things like that, despite the fact that our own personal perceptions of our cognition might be that I'm really struggling. And so one of the things that sometimes can be useful as a tool to help sort of gauge the severity of cognitive difficulties, to actually get an assessment to help provide more data. And so sometimes the self-reported difficulties in cognition are actually more of a reflection of some of these things that Trisha was talking about, things like mood, anxiety, and depression. And so even though the sense might be that my mind is not functioning the way that it used to, that might be more of a manifestation of depression or mood, and maybe might not be such an accurate index of of the actual cognition that one might be experiencing, if that makes sense.
That makes perfect sense. There's a related question from the audience about the impact of mania in particular. Is the impact of mania particularly bad for the brain, manic episodes?
Yeah, I'll touch on that a little bit. I think that in general, when, earlier I alluded to some of the studies that have tried to quantify, things like what we would call disease burden, and that's kind of a fancy way of saying, how many mood episodes has a person experienced, say, throughout their lifetime, or how many hospitalizations and things like that. And so some of the studies that have been done have aimed to look at, measure someone's cognition and then see if there's a relationship between these illness burden variables such as, mood episodes and so on. And again, that literature has been a bit mixed. There is some evidence that it's possible that the manic types of episodes might have a bit more of an impact on cognition than the cumulative depressive episodes. But again, this kind of research is still, fairly in its infancy. But there is a little bit of data to suggest that the manic episodes can be, a little bit more toxic, if you will, in terms of affecting cognition relative to the other types of episodes.
Victoria, or anything from you at this point? Are you okay carrying on with the questions as they're coming in?
I think I'd rather get the questions answered. I would just echo that what Trisha and Ivan said. All those things I think are really spot on. I relate to them.
Okay, well, let's stick with the slightly more clinically focused ones. And then I do want to save enough time to get into kind of specific treatment interventions, if there are any, for cognitive difficulties. But another clinical question that came in is, I'm curious to know about the experiences of loss of language, word recall, speech incoherence, and a transient stutter post-episode. Is this something that you see much clinically? Maybe a question for you, Trisha.
So a couple of things comes to mind. So things like speech incoherence, potentially, I'm not sure about this. So things like speech incoherence, or if I'm interpreting that correctly, speaking in a way that does not necessarily make sense to someone who is listening. Within an episode, that might be a manifestation of psychosis, for example, in mania or in depression. We see what in psychosis, we see what's called, we can see what's called like thought disorganization, where the ideas are not necessarily being put together in a way that's linear. But that would be within an episode. Post-episode, I guess I would be wondering more about, especially with the stutter, incoherence, potentially some medication side effect. That may be more a manifestation of a medication side effect. And I think this is far lower down the list, but just to be comprehensive, like whether there might be something neurologically going on, but I think that's pretty unlikely. But yeah, probably a medication side effect would be sort of my first guess with that.
Thanks. And then a bunch of questions coming in related to treatment intervention. Somebody has a specific question about ECT and about the consequences of ECT for memory, which might be a little bit beyond the realm of what we need to focus on in the last 5 minutes of discussion that we have for this webinar, but is a great question. But I do want to hear from all of you about what's the state of play for specific interventions to improve cognition in bipolar disorder. Is there such a thing?
Yeah, I'll comment on a few sort of treatment strategies. And again, I want to sort of piggyback on some of the wonderful examples that Victoria was giving, and that Trisha alluded to as well, that I think some of the, interventions or management strategies are really ones that I would consider to be things that are, things that all of us could use to, improve brain health. And again, not to get into great detail, this would include things like exercise, which we know is very important, maintaining a good diet, maintaining good sleep hygiene. The other thing that seems to be really, we're understanding that associates with kind of increasing our brain plasticity is also maintaining our social interactions with others. And again, this is, during these times of COVID, again, that's yet another strike that we have against our ability to maintain, you know, those positive relationships. But I think that, you know, keeping our minds active, you know, and both in terms of, you know, engaging in tasks that might be, you know, related to work or related to hobbies, you know, things that, you know, musical pursuits, artistic pursuits, you know, all of these things are critically important to, you know, to keeping those brain cells active and to, um, you know, encouraging those connections to be maintained, and you know, maintaining our social contacts. You know, social interaction is critically important. It's something that we're really understanding is yet another sort of pro-cognitive type of strategy. Um, you know, beyond those general types of issues, obviously there's a lot of interest in the discovery of various, you know, medical treatments for cognitive difficulties, not just specific to bipolar. You know, this is relevant to neurological conditions, dementia, traumatic brain injury. Um, you know, there are some, you know, there's a host of sort of so-called pro-cognitive medications that are under study. You know, at UBC, we're in the midst of doing a multi-site study looking at one particular drug called lorazepam, where we have some pilot data that shows that it might show some, you know, some at least modest improvements on cognition. But the reality is that we don't have yet a bona fide, you know, drug or agent that we can really identify as something that we should definitively, you know, prescribe to people to, you know, improve cognition in a meaningful way. Um, so in terms of other psychosocial types of things, that there's a therapy called cognitive remediation therapy, um, which in its broadest sense is really an effort to, it really has two goals in mind. One of them is, if you think of the brain as, you know, the analogy of the brain as a muscle, one component of that is to exercise the brain muscle by doing things like engaging in, you know, computerized tasks that enhance your, you know, cognitive functioning in the various areas that we've talked about: attention, concentration, memory, and so on. So that's one component of most cognitive remediation programs. And then another one would be just kind of coming up with daily strategies to help overcome these difficulties. And I think that would correlate more with the kinds of things that Victoria is talking about in terms of, you know, the self-management strategies. You know, if we recognize what our cognitive weaknesses are, how can we use some of our cognitive strengths to actually, you know, circumvent these limitations so that we can continue to function optimally. So again,
that sounded like they were foundational to Victoria, right? The way that you were describing them.
Yeah, if I don't, do we have time where I can chime in a bit?
Can you a couple of minutes, and then we'll
Yeah.
need to wrap to go to the resources.
Yeah, I was just writing some things down. So the things that Ivan and Trisha were saying around exercise and sleep, and what I notice a lot of times is that those are the two things that are often the most difficult for people to get into a habit of, but it's also the one that's the most accessible. And I really love the idea of self-management tools because it does not rely on any outside sources, your own motivation, of course. So you might need support from others to help you take some steps, but it means it's always available usually. And so when I've talked to people, a lot of times their sleep is really wonky and they've never thought that it needs to be sort of tweaked. And it's a huge difference for me. So as I get more stressed, my sleep becomes worse. So I need to really stabilize it. And I notice an immediate difference. And exercise, I didn't even think of this. I do it for mood, but what I also realize is because you need to be focused when you're doing a physical activity or you'll trip, if you're running anyway. And it clears my head. So it really, it's as if it it's like going through a car wash for me. So my brain just feels lighter, better, and it's also a sense of mastery. And one of the other things that weren't mentioned were, and I'd want to emphasize also the social contact, which I think there's something that we don't really understand how it works, but that social contact, I think, really makes connections within our brain, whether it's because we have compassion and empathy experiences. And all of these things work like medication in a way, because they do change our brain chemistry. By the very fact that we're doing something, it changes how we're operating. One, I really feel like finding something that gives meaning and purpose in your life, so that you're not only activating your brain, but you're inspiring it. And I think that that happens, and it can happen on a very small scale. It can happen when by doing a new hobby, by learning something where there is a slight frustration, but not total frustration where you want to give up and feel like a failure, because if you're feeling depressed, that's not going to be very helpful. So those were probably some of the other ones. And also, I don't want to get into it too much, but working on trauma-informed therapy, where you're really aware of what your stress response is, so that you can learn to bring those cortisol and other kinds of chemicals down in your body. Because I find then what happens is that that often interferes with my ability to be present. And it also interferes and can trigger certain mood states. So for me, that's going to a counselor. It's free mental health team. I've got a great therapist. It's really helpful that way. And music is another way that I engage my brain. It's more passive, of course, but I actually think it does a lot to, I know it's worked for some dementia, where there's some research that says it really starts to at least soothe some people. I don't know what it does for cognitive. Anyway, so I'll stop there. I've got lots of, so this is the stuff I love because it's so empowering to do. And yeah.
And that's the key from it. You know, my message from hearing the three of you present so beautifully today on this topic is that there is an awful lot of stuff that is under our control within the space of thinking and memory and cognition. And that's, I think, the most important message to share as part of this webinar today. Okay, well, let's end as usual with some resources and tools for you. I'll go through this fairly quickly. Trisha has produced a blog at the beginning of this year on this very topic. So if you'd like to read some more of her thoughts on cognition and the brain and bipolar disorder, we encourage you to visit that on the CREST-BD blog site. Ivan mentioned a number of points around cognitive remediation therapy, and in your resources document, we've provided links to two groups, one scientist and the BC Schizophrenia Society, who provide some deeper resources and tips and tools in this area. Of course, our Bipolar Wellness Center has a suite of information on cognition specifically geared for people with bipolar disorder. And as part of those tools is a link to the International Society of Bipolar Disorders Cognition booklet that was produced by the Cognition Task Force, which Ivan was actually a member of. It's a very nice resource which gets into a little bit more depth on some of the topics we talked about today. And then our CREST-BD quality of life tool actually measures cognition as one domain of quality of life over time. You can use the online version of that or follow our project Bipolar Bridges to develop an app to help you have this in your pocket. And then the CREST-BD main academic website has a place where you can sign up for our CREST newsletter, CREST Currents. That will give you information about the next talkBD event, which will happen in 2021. As well as information about the various studies that we're doing. For example, our bipolar disorder and magic mushrooms survey, which is happening internationally. And that's also the place where you can access all of the prior recordings from our talkBD live events. And you can see a list of those there that we've held throughout this year. And then finally, and very importantly for us, if you haven't yet completed, it's a 3-question survey. It should take you less than a minute, but it's so valuable for us to hear about what you would like to hear us speak on, what topics to cover next year, and give us, candid feedback about whether you think we're doing a good job or not, or what you would like to see different, change, or kept. So with that, a huge thank you to all the people who support our work and our funders, the Canadian Institutes of Health Research in particular. I'll just pass us back to the panel members for any final thoughts on this very busy webinar, which we all kind of kept our cognition going for. Congratulations, that's a lot with 3 presenters at one time. We did it, kudos. Any final thoughts, Ivan, Trisha, and Victoria?
Yeah, I guess I would just, say again, thank you so much for joining us. And I guess my only kind of final thought would be, whether you're someone living with bipolar disorder or not, I think that it's important not to feel isolated in whatever struggles, cognitive or functional, that you might be having, and to know that we're all kind of struggling together in our own unique ways. So just make sure to reach out to your friends and your support network if you feel like you're struggling, because we're all in this together.
Yeah, I would just echo that. And if people that are watching are concerned or want to get back sort of skills, cognitive skills that they feel like they've lost, to really reach out, both to talk about it with friends and people that that you trust, but also, finding ways that you can get assessed. And then really, if you can become proactive, it makes such a difference. And then I feel like, in my experience, the likelihood of a better outcome, so that the results are really positive, are increased far more. And then you'll have setbacks. It's a given. It's part of the process. I would say, don't assume that how you're experiencing things now or in a setback is what will be in the future. Things change and they improve. I can say that.
Yeah, that was, I have very little to add other than, just to think about, we all bring our strengths, our talents, and our weaknesses and our limitations. And, it's great for us to embrace that. That represents who we are. And also that there are some things that are under our control, some things that we can do to try to make it through the day and survive and become inspired too. I think that's part of something that we all share. So yeah, so thank you very much for joining us today.
Thank you to our panelists and to everybody who joined us on the line. Stay safe, stay well, and we will see you at the beginning of the new year. Thank you and goodbye.
Thank you, everyone. Thank you for being here. Bye.
Thank you.